Today on Let's Talk, we have two guests from UAMS, the Center on Aging. And we have Samantha Hollis and Melissa Blaske. Welcome, ladies, to Let's Talk Jonesboro. Tell us a little bit about what you do at the Center on Aging, because I've been aging for a long time. So tell us what you do at the Center on Aging.
So in essence, we're all aging, can't not age. And we are a program of the Donald W. Reynolds Institute on Aging out of Little Rock, but we have an office here in Jonesboro. We're across the street from St. Bernard's in the 303 building. And our primary mission is to improve the lives of older Arkansans. So we do that through many different programs. The main thing what we do is health education. So with aging adults themselves, but also with their family caregivers. So we cover 17 counties. So we go all the way up to Missouri, all the way over like White County, down to St. Francis, and then of course over to
That's taking on a lot of people, especially as we age, because I'm at the tail end of the boomer generation. So there's a lot before me. So there are a lot of aged people in those 17 counties. Well, okay, so you've got this going on, and people need to come to you when?
Well, now, because we're one of these programs that you don't realize that you need us until you're in a crisis. So you need help for your aging loved one 2 days ago, and you're like, oh gosh, what do? I haven't pre-planned any of this. I don't have my finances correct. I don't have my advanced care planning correct. You know, mom's had a fall and now she has to go to the nursing home or go to rehab. And so we're trying to be proactive and help educate people on what resources are available, what they can do to try to stay healthy at home, independent for as long as possible, and just also have those planning measures in place.
Okay, and Melissa, what type of things do people need to know? Because a lot of us deal with aging loved ones. A lot of us are aging, reaching the point where we need help with certain things. So what are some of the fundamental things that we need to know?
I've also had a crisis this past summer with my own father, and like she said, I didn't know where to turn. I mean, I was in Jackson, Mississippi, had nobody, and I had to take care of my father. So, I mean, I think you do need to know what caregivers are out there. I think you certainly need to know how your parents' health is, how your own health is. But like, I went to the doctor with my father. You need to know their medications. You need to know what their diagnosis is. You also need to go into their home and make sure their home is safe for them. I had not done all that, and then I mean, it was hard.
That's one of the biggest things is when you first realize that a loved one is not going to be ambulatory,
Right.
and you need to make your home.
Make adjustments, yes.
And that can be expensive.
Yes.
It can be incredibly stressful.
Yes, it was, yes.
And for that person, it's a loss of identity and a feeling of helplessness. So you're dealing with a lot of factors right there.
And we see that a lot. You know, people come in for holidays like Christmas, and you would think that's kind of a slow time because people don't get out much, the weather's bad, whatever. But we see that a lot. Parents come in, or the siblings or kids come in for Christmas, they see how bad mom or dad has gotten, and they're like, oh, they've got to go to a nursing home. So then they're in crisis mode trying to figure out what they got to do because they don't live here. They never do, no offense. But
No.
they're trying to figure out what resources are available for this person that lives here. You know, we also see a lot of grandparents that still have grandchildren they're raising in the home. So, I mean, that takes a toll as well because you're trying to provide for the children, but yet also make sure the older adult has their needs met. So
Aging at a lower level.
Yes.
And so,
Yes.
because it's harder, the last thing I want to do is be a full-time parent of a toddler.
And there's so many there are.
And there's so many who are. And not to disrespect those who are doing it at all, because I admire that. But
Yes.
it's just not on my want-to-do list at the moment. But I think it's incredible that you guys provide these type of services. And people probably don't know. A lot of people don't know.
Yeah, so we're really blessed. We are funded by the tobacco settlement. So as one of the programs of that, of course, we want to improve our health outcomes. So Arkansas is still one of the worst states. I don't know, Mississippi might be a little bit worse.
We always got Mississippi.
Obesity,
course.
smoking, just overall lifestyle. Arkansas is always one of the lowest ones on there for multiple reasons, not because of necessarily the people, but
Right.
the rural places, no transportation, low finance. All of those things play a role as well. But
I think transportation is an issue that is probably
it's high
one
on
of the
my
more.
list up here.
Big barrier.
How do you
Yes.
how do you do that? How do you deal with transportation issues?
It's a bear. We don't have that luxury to be able to provide transportation for people that we serve to come to our educational programs, and that's sad. They have the ability sometimes to get to their doctor's appointments, get their basic stuff, but we see people all the time. They have to hire a private aide to come in and help them get their groceries, or take them to their hair appointment, or take them to go play bingo one day. And so it really is like a loss of identity, because you're taking their keys away, or they may decide that they don't need to drive anymore. But yet there's so much they could still do. So
Well, in Jonesboro, we're fortunate to have the jet transit
Yes.
and paratransit systems that help people get around and get to
Right.
doctor appointments, that who aren't ambulatory. But along these same lines, you are doing an Arthritis Foundation program called Walk with Ease. Can you tell us a little bit about that?
Well, I'm the
she's the
leader
expert.
Okay.
of Walk with Ease in this area. I started a group last week in Forest City, actually. I go down there 3 days a week. Ours here will be at Southwest Church of Christ 3 days a week for 6 weeks for an hour. It is for people that don't necessarily have to have arthritis, but it's just an overall program to help you get to walking, getting to feeling better, getting you off the couch. It's evidence-based. The Arthritis Foundation worked with Stanford and University of North Carolina to make this program, be beneficial to people that have arthritis, but yet those that don't too. And of course, if you're up and walking, you feel better. The depression, anxiety go down. Your overall health can go up. It helps your joints.
The social aspect.
The social
too.
aspect. That's what I've seen. In this last class, we have a great time socially. So, and again, it's just an hour of your day, and that's not long. So,
And I think it's real easy to, when you have chronic pain or other chronic issues, not even necessarily arthritis, it's real easy to just sit back and say, oh, I hurt too bad, I don't want to get up. But that really is the treatment plan. Research has proven that the more you're active, the more you get up and walk, and all those benefits that she mentioned, it's really going to improve your quality of life, also your longevity. Because we know, look at some of the ones we've seen through the Healthy Ager Project. They're over 100 years old and can do push-ups,
Yeah.
So, it really does greatly impact that. And when you talk about Alzheimer's and dementia, research has proven that's one of the only things that we know for certain is that diet and exercise can prevent some of those brain changes from occurring. So it really is important, and we try to get people empowered and engaged and excited to get out. We do some different incentives that we provide. This group in Forest City really likes Jeopardy, so we're going to do a Jeopardy party for them at
That's
the end.
great.
Yes.
That's great.
So
As you age, a lot of people feel like I've missed this train. I can't walk, or I can't walk with ease.
right.
And is there inspiration, and you talk about even having dementia? If someone's feeling like they see signs of dementia, is that recoverable?
So dementia is not curable,
Correct.
but there are things you can do to improve the quality of life. Certainly they could still get out and do the things they like. You're just going to need more assistance. And so that's where it helps to have that educational knowledge. Okay, what's coming next in this disease process? But I certainly think, physical activity is one of the best things that medicine can provide. Medicine can provide.
I have all levels in our current group down there, from people that actually need assistive devices to somebody that has early signs of dementia, and some that just could walk circles around the rest of us. So it doesn't matter what your level is. It's just come, walk. It's moderate
Right.
exercise. We start with a welcome, and then we do a warm up, then we do our stretches, and then we walk for 10, and then we cool down and do some more stretches. So it's very low to moderate intensity, so anybody can do it.
And don't feel intimidated because
No.
somebody else can do more.
No, and that's the beauty of it, because there's all levels in there. So if you get tired and one lap is all you can do around our, like if in the gym, then you go and you sit down and you rest. Maybe you do one more lap. You know, it's just, yeah, I mean,
It's just to get
it's
you
about
moving.
you, and it's about your victories of you know, what you can do. So, yeah.
Yeah, very nice. Well, tell us what else is going on. Are there any other? I've got a list of
do have
little
a
things
list.
that you guys do, and it's not very much. It's bingo, fall prevention, 3 or 4 times a week, home safety tips and classes that 3 or 4 times a week, prostate cancer peer network.
So we have a multitude of educational programs that we do. So what happens is we have 7 centers on aging throughout the state. Every one of those have a director. Once a year we get together and we look at statistical data on what's causing hospitals, healthcare agencies the most amount of money, what's causing the most morbidity and mortality, what are these issues that these rural areas face, and that's what we're trying to combat. So every year, one of the biggest things we see is falls. So you'll see a lot of the things that we do focus on fall prevention, whether it's exercise, whether it's going through your home, checking different things to make sure that's not a fall hazard, whether it's just educational knowledge on, are you on a medicine that might make you more at risk to fall? Are there strengthening things that we can do at home? Is there PT? Because we know that once an older adult suffers a fall, you can come back from it, but depending on what their frailty level is, they could really certainly decline after that.
Right. A fall is the thing that, you know, my little philosophy at having older siblings and watching my parents go through some of those things is take the stairs up, take the elevator down. Nobody dies falling up the stairs. But what are your guys? What are your advice? What's your advice?
I think we see a lot of people that probably need assistive devices, such as a walker, even a wheelchair, that don't use it just because they're fearful of that loss of independence and maybe a lack of knowledge of knowing how to correctly use that.
That's
And pride.
a big one.
Yes.
Yes, and pride, yes.
Yes.
Absolutely.
And I think sometimes that's probably where some falls come from, or they're in their own home and they're thinking, oh, I can reach up in that cabinet and grab the sugar or whatever and not use their walker, and that's when a fall happens. That's probably the biggest thing I see. I think medications probably play a big role.
Yeah, medications is another one.
And then just, you know, weakening, not staying active, not exercising. You know, once you kind of stop doing those things, you really decline very quickly.
Yes.
You know, we see people that, I hate the power chair. I hate the power recliners that like tip you up and dump you
yeah.
out.
Get up on your own as long as you can.
Yes,
right?
because
And that's
that's really
true.
a core muscle group that helps you to stand up out of a seated position, and that just totally takes that independence away from you.
But there is a level where that's important
Yes.
Sure.
for certain
There is.
stages, correct?
Sure,
Yes.
absolutely. But speaking of that, I bought my
But
dad
if you're
one.
able to do it,
Did
then
you?
just yes.
So you were there.
But my his physical therapist came in and was like, I don't want you using that chair. You need to get your upper body strength and your leg strength. So I'm like, oh, I wouldn't. I mean, but I didn't consult anybody. I was just
Yeah.
in that panic mode,
Yeah.
you know.
Right.
So
Trying to do the right thing.
yeah. So I mean, but he has it for at whatever moment in time he does need it. So, but right now he needs to strengthen himself. So
That's
yeah.
interesting because and that's the perfect example that I think so many people are going through right now. And
I can't
I'm
tell
so
you how many
glad for what
times
you
I've
do.
had people, even people that have a wealth of resources, saying, "Oh, I wish I would have had you before my dad died. I wish I would have met you and known all these services that could have helped me."
Yeah.
So we're just trying to
Absolutely.
spread the good news that we're here to help, and we're both registered nurses. I have one other registered nurse in the office, and then we have a community outreach support, and then our administrative assistant. So we're a small team, but we work together to try to do our best. And
that's fabulous.
yes.
Well, I'm following them out of the studio as soon as we finish up here. And they're with the Center on Aging. There's Samantha Hollis, Melissa Blaske. Do not hesitate to call on them.
Mm-hmm.
So thank you so much, ladies, for joining us on Let's Talk Jonesboro.
Thank you for having us.
Thank you so much.
Yes.
Thank you.
Thank you.